Hi everyone, it's Faithful again. We're back at it. I know it's been like 3 months since the last episode, and I've been getting calls and text messages to know what's happening. Well, we're here. It's just a little delay, but we are still at that business. So we're going to talk about something very important today. And I know I don't do videos, but it's the end of the year, and I thought we're going to talk about something important. I like you to see my face. People have told me, why not just do a video? I think it's more interactive. You can see me. So I said to try this out. So let's see how that goes. So we're going to talk about coronary artery disease today. And what is coronary artery disease? It is the most common type of heart disease in the United States. And quite honestly, for some people, the first sign could be a heart attack, I always ask myself, what is a heart attack? And to bring everything to make it simple, I would explain it this way. Coronary artery disease is caused by plaque that build up in the walls of the vessels that supply the heart and other organs. And those blood vessels narrow when you have plaques that develop. So you have a plaque like that. I'm sorry, my paper's falling up, but you have a plaque like this. So this is the blood vessel, and it narrows. You can start slow, like 10%, 20%, 30%, 50%, and 100%, where the whole vessel wall is blocked and you have no blood flow through that hole. Just think about a tube. Let's think like a plumber for a second. You have a tube that is round, okay? And all of a sudden that round tube is blocked a little bit, 10%, 20%, 30, 50%, and all of a sudden the whole vessel, which is a tube, is blocked and you have no flow. And when that happens, you have no flow through that hole. You have no blood supply to the muscles of the heart, to the organs, and people can just pass out and die. That's where people say they have a massive heart attack, and sometimes they cannot be revived. So what are these plaques? Plaques are cholesterol or other substances that can build up in the walls of the arteries of the vessels of the heart and cause what we call coronary artery disease. Now, these plaques, this cholesterol debris and other substances can actually occur slowly with time, through months, through years. And to be honest, people can just all of a sudden, boom, when they have 100% closure, which you call a massive heart attack. Or it could be slowly 10%, 20%, 30%. But this process takes years or months to develop. It's an inflammation that happens in the blood vessels. And with time, it can get bigger and bigger, and people start having symptoms. It could be chest pain, it could be shortness of breath, it could be nausea, which I'll get to and talk more about. But those symptoms can happen slowly and get worse and worse until the event happens. Or it could even happen where the inflammation has been there for years, people feel fine, and all of a sudden that inflammation causes what we call atherosclerosis to continue to happen, and boom, all of a sudden that hole can just close right away and people can even pass out or die. So my point being, it's a slow process that happens over time. But again, the symptoms that people experience could vary, all from a small scale of just feeling like a small discomfort to when people are a massive heart attack, where people could just pass out and die. So what I wanted to always let you understand is that this is something that happens over time. So our lifestyle, that's why I say lifestyle change is important to prevent or to halt that process. Now, what are the risk factors for coronary artery disease? 1, overweight, obesity. 2, high cholesterol. So like I said, cholesterol deposits in the vessels and the walls of the artery. Another one is smoking. If you smoke tobacco, that's a high risk. Diabetes, we talked about that 3 months ago. Diabetes is a huge risk factor. Actually, we say if you have diabetes, you are one of the top risks for coronary artery disease. Another risk factor that is very important to know is family history. So if anyone in your family has had heart attack or coronary artery disease, what you also call heart disease, you have to be very careful, because the likelihood of you having it is high, especially if someone has had it at an earlier age. So say age 50, 40, or less, you have to be very wary, especially first degree relatives. So your brother, your sister, your mother, your father. Another big risk factor that I always like to highlight is physical inactivity. If you're always sitting there, a lot of people work from home, they don't move around anymore, they don't get going to different places, exercising. If you're not exercising anymore, physical inactivity is a risk factor. Stress. One of my first episodes was about stress and mental illness. Those are big, big risk factors for coronary artery disease. Another one is excessive alcohol use. So if you drink wine, one glass a day, that's okay. 2 glasses a day. But when you start doing excessive alcohol use, you have to be very careful, because that is a big risk factor for coronary artery disease. Now, another thing I always like to mention, which people do not really think about, that is a big risk factor for coronary artery disease, other like inflammatory diseases like lupus. If you have lupus, or you have rheumatoid arthritis, or things where you have inflammation, because this process again is inflammation that happens in the walls of the blood vessels of the arteries. So these risk factors can cause coronary artery disease. Now, another thing I always want to mention is, how can we diagnose coronary artery disease? What we want to talk about today, how can we diagnose coronary artery disease? One, we can do what's called an electrocardiogram. The other name is ECG. This is where we look at the the activity, the electrical activity of the heart. So you may not be able to understand what that is, but if a doctor or a medical professional that has studied how to read that, sees it, they can say, this electrical activity is abnormal, it's concerning for coronary artery disease. Another test you can do to diagnose is echocardiogram. Echocardiogram is sound waves that are able to generate images that shows our heart. And so we look at the muscles of the heart, how it's pumping. Again, when you have coronary artery disease, it can cause muscle weakness and decrease the ability to pump blood through the vessels of the heart. Another way is which we do a lot as cardiologists is what we call cardiac catheterization or coronary angiogram. This is where we go to either the groin or the arm, the artery here. We use a tube, flexible tube, small tube, through a needle. We go to the heart and we can shoot the dye and look at the arteries of the heart to see, when we shoot the dye, is there blockages and how much is the blockages. When people have a heart attack, they rush them to the hospital. We do this test right away in a few minutes to try to open those vessels up. So this test does not just help to show us the blockages, it also can help to treat, to open up the vessels that are blocked. Another one is a coronary calcium score. This is something that is big now, where we do all the time, because we can kind of see how much deposition is with calcium in the vessels. And that can give us an idea of whether we have a high risk for coronary artery disease. And if there's major high calcium level, it correlates with our risk of coronary artery disease. Also, we have a CT angiogram, where it's similar to the catheterization I talked about, but this is a CT scan. You go in, they shoot a contrast, and they look at every vessel, and it can show you if there's blockages and how much blockages we have in the vessel. Now, I always talk about, yes, we have this. How do we avoid it, or how do we treat it? How do we avoid it? One, increasing physical activity. I always urge you, if you know you're going to work, take the stairs rather than taking the elevator. Even if you have to climb 10 stairs, even if you can do all of them, do 5 steps or 5 flights, and then you can take the elevator to the rest. Try as much as possible to exercise about at least 3 to 4 times a week. I recommend about 5 days a week, if you can, for about 30 minutes. Trying to be careful with your dieting. Low salt, low sodium, low fat diet. Of course, we talked about Mediterranean diet the last time, talking about the low carbohydrate diet, talking about, we talk not just vegetarian. When you say, vegetarian diet, we talk about low fat diet. Is very important to decrease our risk of coronary artery disease. And it's important to do blood work to see how much cholesterol you have. We have the good cholesterol, HDL, the bad cholesterol, the LDL. So the level of that bad cholesterol, LDL, in our bloodstream is very important. If it's high, it puts you at a very high risk for coronary artery disease. So when you go to do your blood work, see what that number is and ask your doctor if that number is high. Because if it is, you may not just need to you have to definitely be careful with your diet, but also maybe to take medications to bring the number down. If you're diabetic, you really, really have to work very hard to keep your sugar levels down. A1C, hemoglobin A1C level of less than 7 is our goal. If you take insulin, you have to make sure that you take it as your doctor prescribes it. If you take even oral medications, the shots you may take, our goal is to keep our hemoglobin A1C less than 7. If your A1C is more than 9, I urge you to talk to your doctor about taking insulin, because you need to get it at least much lower to less than 7. If you have high blood pressure, it's so important to ensure that your blood pressure is always under control, because high blood pressure is a high risk factor for coronary artery disease. So all your medications, you should take it as your doctor prescribes. Check your blood pressure like we talked about in our episode every single day to see that the number less than 140 over 90. And if you've had a heart attack before, or you have known coronary artery disease, your number, the top number should be less than 130 and the bottom number less than 90. Please, as much as possible, try to decrease stress in your life. And if you need to talk to a doctor or a therapist, you should do the same, because it's important to see that you get your stress levels under control. If you have some mental illness or you feel like there are things in your life that you need to talk to a therapist about, you should, because stress increases our risk factor for coronary artery disease. I always say that to be forewarned is to be forearmed. It's a new year, and honestly, in this new year, we want to try our best to keep our health very, very as great as possible. Remember, health is wealth. And let me let you know a fun fact: about 695,000 people died of a heart attack in 2021. And that number has gotten higher, over 20% in the last 2 years. That is really scary. So I always say so that number tells me 1 in 5 people died of a heart attack in 2021. And that number has gone higher, 20% higher in the last 2 years. So I urge you to do the best you can to take control over your health, over your heart in the new year. Remember, the heart leads to great things in every way, through love, as we show to our family in this new year coming along, and even in our health. So keep your health going, and as you do, I promise you, you will feel better, and you will also be able to live longer. I always say, follow up with your doctor. Every year you should do a checkup to see how's your cholesterol level, how is your A1C, how is your sugar levels, all those things. You may walk around thinking you're looking well. How is your blood pressure? These are things you should be able to ask and do or check every time as much as you can to make sure your blood pressure is under control, your sugar levels are under control, or your A1C is under control if you're diabetic. Even if you're not, or you don't even know, you should check that. So I hope that you guys do well. I wish you the best in New Year. Take care. Much love.